I learned that it is my responsibility to continue to learn and to study what is available to my patients, because at the end of the day, when I didn't know that mercury was toxic, I poisoned my own family. So imagine the grieving that you go through knowing that you have harmed people and you swore to become a doctor to actually help people, that you shall not cause any harm. And I feel that is a privilege for me to see a person and be part of their health journey.
Hello, and welcome to the Energy Flow podcast. I'm Kelly Kennedy, and I am here to discuss all things energy, fascia, lymphatics, oxygen, and water. Over my 26 years of being on this journey and 19 years in clinical practice, dealing with chronically ill, chronically pained, to the optimizing of health and to everything in between, we have learned throughout these years how to efficiently and effectively teach people how the body works, get them engaged in that system, help them understand how the universe works and how those two connect. And that's what this Energy Flow podcast is about. Whether you are new to us or you've been a longtime listener of over 4 years now, we are so happy and honored to share our heart's honest truth about what we know, what has worked for us, what's worked in the clinical practice, and what might be the key to your next step in your journey. Thank you for joining us, and thank you for sharing this with all that it will resonate with. We look forward to each and every moment of our genuine connection. Thank you for listening. Welcome, vibrant beings. This is Kelly Kennedy with the Flow podcast, and I'm very excited. This is a long-awaited interview, actually. I've known of Dr. Yolanda Cintron for, I think, 4 to 5 years now, and she works in Florida as a female biological dentist. And as you know, we have not had any kind of dentistry on the show in a little bit of time, so I'm very excited about talking to Dr. Yolanda about her practice as a biological dentist and what that means. And we've had a nice little interaction here to talk about. We're going to get, in the next 30 minutes, you're going to hear a lot of things that maybe raise your questions about some things that you've maybe not thought about before when it comes to dentistry. But what I really want to talk about is really her approach, because I'm so glad. I was just talking to Dr. Sharon Stills last night. We were recording for one of her summits, and Dr. Sharon and I have known each other for 2 decades because we've been doing biological medicine for 2 decades. It's not common to find other people that have been doing this for that long. That's why the group of us, we kind of like are a little cult of biological, bioregulatory medicine people. And we were talking about how we're so glad that dentistry is finally talked about, that 20 years ago, we felt like the only person talking about it. And now it's very common. But what I have found with that is that we need to be more critical in thinking and deciphering. And when I started to talk to Dr. Cintron, she started to talk about her health history. And wow, was I impressed. And I really want to discuss that, because everything in life is an iceberg, right? We can look at the tip, and then under that little piece that's sticking out of the water is this huge mountain of information. Everything's a rabbit hole, as we know, right? And so when I started this podcast, it was like, I got to interview a biological dentist first, because to help somebody's health, you got to really get them to understand that. And so now 140 so episodes in, what I really want to give you today, and what Dr. Cintron's willing to give us, is for the part 2 people, you're going to get a checklist of how to find a good biological dentist. And it starts with the most important thing, which is looking at you as the whole person. So Dr. Cintron, thank you so much for your time, your work, and who you are, and giving me the opportunity the first 20 minutes today to really go fast and hard to get to know you like we did, so that we could have a really meaningful podcast today. So thank you.
Thank you, Kelly. It's a privilege. It's humbling to be on your podcast. 26 years ago, when I didn't know what biological dentistry was, I was shocked by the information that I was presented. My background is in chemistry, so I was like, wow, I learned that it is my responsibility to continue to learn and to study what is available to my patients, because at the end of the day, when I didn't know that mercury was toxic, I poisoned my own family. So imagine the grieving that you go through, knowing that you have harmed people and you swore to become a doctor to actually help people, that you shall not cause any harm. So on a daily basis, it's very humbling, and I feel that is a privilege for me to see a person and be part of their health journey. So I don't take it for granted. I don't take that anything I do is the ultimate thing, because you always learn something new, every year. So I'm a constant avid learner. I'm in the medical world, the biohacking and all the people like you that are educating people. I greatly appreciate what you're doing, and the people in the health world that are really taking time. Like you say, life is time. So you're taking your life and your time investing in people that you don't know, with the possibility of changing or saving somebody's life. So thank you for having me.
Oh, well, thank you. And I really feel that from you, that I too am very honored when somebody puts their health in our hands as a partnership. As you said, it is a partnership that we're here to work together. But what I find is that we can often, listening to the client is the key to helping somebody. And what I find with the discovery calls I do and working with clients, that often they're not feeling heard and they're not seen as a whole person. So how do you address that in your practice, knowing, and let me back up for a second and just applaud you, because what you said, and humbled as you are, it is so true that the second you think you know anything, you learn something new and go, oh, wow, that just undid what I learned. But that takes a certain personality that, I mean, you went through, I think it's 9 years of school between undergraduate and graduate in dentistry. You had to become a medical doctor, then a dentist, and then you came to this country. So I'm figuring you had to learn it all over again. Is that true?
Well, no, I was born in New York and I went to school in New Jersey.
Oh.
So I am a real American.
Okay, just your accent, and I know you're from.
Yeah. Well, my parents, they're my mom and my dad were born in Puerto Rico, but they are actually Eastern European. My mother is French descent, and I have my 23andMe. I'm like a rainbow. I have all the colors. So
well, your energy is rainbow too, and you have all the colors. And I just applaud you for continuing to learn, is what I was going to say, because that I've been being in this industry, working with medical doctors and dentists and physical therapists and acupuncturists and chiropractors and everybody who gets these licenses, massage therapists, not myself, continuing to educate yourself and having to relearn and unlearn things that you thought you knew and throw it out to start new I applaud you. That's not easy, because you have to reinvent yourself. You have to reinvent your medicine. You have to reinvent your protocols. Yeah. And it's constant work. Yeah. And awesome. It's not really.
You need a great team. I have a great team of people I work with. They know that I'm always going to seminars and meeting new doctors. I go to Europe. Dr. Thomas Rao, Klinghardt, all these different people, everybody that's like cutting edge, I'm there. And, we also teach doctors. Most of my patients are physicians, doctors, people that were diagnosed with cancer. But now they're not going to get chemo, you know that. They're going to say, oh my God, what is wrong with me? And they start going into the rabbit hole. And then they really become doctors, because then they're going to learn what is it that they need to do for their patients. Suddenly chemo is not good. It's okay for the patients, but not for them. So then they come here and then we start learning, together, what is it that we're going to do different, because it's got to be from the head to, from the spirit to the head, to the heart, to the diet, to everything that they do. So we are full body doctors in the sense that our medical history is like, you need an hour and a half to 2 hours before I meet you. I look at your blood work. I look at everything you got, past medical history, past dental history, 5 years back. And then
5 years back, she looks at dental history, medical history, lab work, everything. 5 years back. That is comprehensive approach.
Yes. Because, somebody missed something along the line. So it's easy for me to look at a CT scan and the x-rays and do the blood work and do biocompatibility testing, do all that thing. It's easy. But I want to know what went wrong from before, because I'm going to treat the patient at a different level. It's going to be
not just that top layer of like, oh, you have improper compatibility materials, so let's just change it out and call it a day. Or, oh, you have a root canal, I'm going to extract it and move on. You look at it so much deeper. And as a biological investigator, I appreciate this approach so much, because you're taking the full picture and all the puzzle pieces and investigating with that client who probably knows more than the blood work and the lab work. And so
people know what got them sick. You ask the patient, what got you sick? And you shut up, and they'll tell you. Because, I was speaking to a patient this morning, and she confided in me, I'm going to all these doctors, and I'm not getting any results. And I said, okay, I'll talk to you later. And we spoke this morning. And I told her, what's getting you sick? And she said, what do you mean? I said, what's getting you sick. So we got into a conversation, and she said, I have a few employees that are toxic. And I said, you have to fire them. And then she said, but,
just what every dentist says when you go in for a dental consult, you need to fire your employees. And she's not out of scope. Please understand, this is not for medical purposes. This is for lifestyle. This is about lifestyle. This isn't about, oh, I come in, I suppress, I move on, or I just pull it out and put new material in, because that's no different than integrative, right? I just switched out one thing for the other. That's an integrative approach. That's not a true bioregulatory dental full body holistic approach.
Right.
This is a full holistic approach where I'm diving in and going, where was the root cause? And let me get up in there, as my friend Sinclair says, and find what is going on with you. And be that new perspective for you to look at it with you, and be willing to discover why you're grinding your teeth and you might need root canals.
Exactly. Yeah, exactly. Yeah. We do like 30 photos of each, the complete thing. So the patients are going to see, obviously, the physical problems, but we get to the root cause of why is it that you grounded the heads of the teeth off. We have to get to that, because I can restore it, but what about you maintaining it, right? We have to find out what caused the problem, and that goes deeper than the physical aspect. That goes deeper than the TMJ. That's going to go deeper into lifestyle and choices and way of thinking and all that. Because, I'm committed, but they have to do their part, but they have to be aware of their part. If they're not aware, how can they change?
And so how did you, as a biological dentist, I'm just so curious, how did you start to go down that road? Because that's not an easy road to go down, right? To have those tough conversations, the uncomfortable conversations, like, hey, you might need to move. You might need to fire your 3 employees. You might need to consider your relationship. You might need to look at this lifestyle thing that's toxic and try to remove it from your life. How did you go down that road? I'm so curious.
Well, 26 years ago, when I discovered that everything I learned in dental school was not the whole story, then I became responsible. I was angry at first, okay? I cried. I was angry. How can I harm people? They trusted me. I went through that. And quickly, I turned my anger into taking action. What do I need to know? What do I need to learn? I became avid. I would do thousands and thousands of continuing education. I would refer patients to specialists and not get what I needed. So I became the specialist. I went and learned how to do the surgeries, learned how to do the perio, got the equipment, spent the money, bought the lasers, bought everything I needed to buy. And I never thought, I didn't make any money this year. I said, I bought the equipment I need. I implemented. So, putting other people first. And then it's a moral responsibility that we have as healthcare providers, that we shall do no harm. But if you don't know what you're doing, you might harm somebody. So I became very interested in a lot of different aspects. And after I did all the specialties, oral surgery, perio, implant, the whole thing, I said, the doctors need to know this. So I started talking to doctors and to having meetings with local doctors. And then they would share what they knew. I would share what I knew. And I would send them photos of their patients of what I did. And they were blown away. We send a whole report. These are our findings. This is the treatment plan. Are you in agreement? How do you want to proceed? And obviously, the doctors that are into removing the mercury before doing chelation, I started finding doctors sending me patients. I've done chelation therapy for 2 years. Now the patient's in a wheelchair. Can you check them? Well, the patient had a mouthful of mercury, and they're receiving EDTA and things like that. Patients are going into neurotoxicity at the level that they're on a wheelchair. So then how do you speak to a doctor with respect, right? About what
right. And thank you. This is what I'm saying. Like a little information can be dangerous. And the comprehensive approach of doing this for decades and having thousands of patients and treading slowly and cautiously through areas that are new to us as practitioners, rather than going like, there's so much right now that rages trauma. And I'm like, having worked on trauma, I would never call myself a trauma therapist, but literally I've had my hands on bodies for 25 years and I've dealt with a lot of people's trauma. And what I see happening right now is what I call lip service to trauma, lip service to the nervous system, lip service to biological dentistry, versus looking at this approach where you're like, okay, now that we've properly said to you, you don't need a root canal. Now let's figure out why you were grinding your teeth, or what's going on in that stomach meridian where that root canal is needed before it develops into breast cancer.
Right.
And these are the things that we've talked about. But how can you as a practitioner, I'm just going to be honest, like, where do you find the time to have that conversation as a biological dentist?
You have to have it. That's non-negotiable. My patient's new patient experience is 2.5 hours. Before they come to me, I require that they watch, we send links, and they have to watch the root cause documentary, so they know all the doctors, and they know that information. They are required to watch, evidence of harm.
About
and that way, the patient knows
consent.
Okay, right. All these different things. There's a lot of information, great documentaries out there. And then I interview the patient. I interview them, starting with the basic, why are you here? Who refer you? What is, your expectation? And then the obvious part, which is me looking at the teeth and all that, that's the easy part. I have 26 years of experience. So the most important part is getting to know the person and then see what they believe is possible, what they believe that, it's more, it's a lot of layers, So you have to set up the time. I have a great team of people, so they collect the data. They do the CT scan, they do the x-rays, they do the vitals, all that stuff. When I meet a person already, I have studied their on my time. I get the blue form, which is all the data collected, the email of the CT scan, anything they have from prior. I study it before I meet the person, because I want to be effective with the time. And also I want to get into their space and see what they're ready to receive also.
And can you talk a little bit more about that? Because I didn't really bring that out when we had our previous conversation recording, because you don't really know what I do.
Right.
Doc, I was going to bring that up because what I know after doing this work for 26 years is you can do all the red light, you can do all the biohacking you want, but if that body is not in parasympathetic, if that body is not in receptive mode, then you are working against yourself. And so what we got really good at was getting the body into receiving mode. That's literally what I really think I do, is get the body in receiving mode. So what does that mean for you as a biological dentist? Because I know that is not it's easier today to have it than it was 20 years ago when that person comes in and they don't know anything about it. Right. But it's also, for somebody in your position, I'm just so curious, how do you address that?
Well, like I said, we have a lot of data that we get before and we study them. So I introduce myself to the patient, And I asked them, who refer you to, and I already know, but, I just want to see what they're going to share. Sometimes they say something else. Right? There's like, oh, there's 5 people I know, that are your patients,
Right.
but they wrote something else on the medical history. So I kind of like go into their space and then, gently speak to them. And then the question is, why you're here and what do you think I can do for you, opens a whole level of, I'm afraid. You can see that they're crossing their arms, body language. And then we start a conversation that it has to become real. It has to be a real, authentic conversation. And they know that when I enter the room, I'm so authentic. It's like that. That is a different kind of energy that comes into the room, like love. They say love is 200 and authenticity is 2,000 or 4,000. It's like a really high level. Because I want to love on the person. I want to help them, but are they ready? And I ask them, what got you sick? And they look at me like, and then I ask them questions and I see how it flows in the conversation. It's not a script, because you have to be present in the moment. And I allow time to, like, my patients will never feel that I'm rushing anything. And they know that. They know that my time, when I'm in their presence, I'm 100% there. And when I'm treating them, I'm 1,000% there. So that's very important nowadays.
And they're on all levels. They're on the physical, the mental, spiritual, energetic, and emotional level. And, what I was so also impressed about when you were talking about this receiving mode and really getting this depth of the health history and really looking at the person and having these uncomfortable conversations. I so applaud you for this. Yeah. But it's also like understanding, okay, I'm going to help them spiritually and emotionally, but like, what can I do for them on a physical level? And if you could talk a little bit about how you approach that. And I mean, it's hard to find somebody with the tool set that you have. You have a lot of tools in your tool belt. You're not.
But I've been doing it. I've been doing it for 26 years.
That's the key right there. And she didn't get stuck and go, okay, now I'm getting this. I'm going to continue to expand.
Yeah. I love learning. I think that it's such a privilege to be in the medical dental field nowadays. My intention in my heart has always been sharing. People need to know this information. Sharing it. Why it's not mainstream? Why is this not mainstream? And I asked a toxicologist, and I said, why is this not common knowledge?
Yeah.
And he said, you know why, doctor? The toxicology book is this thick, and it's mostly mercury toxicity. So all scientists, we all know that this is a problem, but this has to go main media. This has to go out because the facts are there. All the scientific facts are there. It's just a matter of, somehow now with social media, I think it's fantastic. What you're doing is phenomenal. I applaud you because it takes time for you to do this.
It does. And it takes time for the message to get out there. I mean, it's funny. We started this at the same time. 26 years ago, I started 27, actually. I started having the same conversation. And I'm like, oh my God, I'm still saying the same thing that I've been saying for 27 years. And we've gone through a lot today, but I just want to share with people, like, at the same place, an understanding. And I'm not trying to sell her services or her as a dentist, because
I want people to get
way out. But I want you to understand, she's going to create a checklist for you to know what to check off. It's not just as easy as, I'm going to go to the AOMT website and find somebody that took a class. It's how deep are they doing this? What level of devotion do they have to this? Are they willing to be wrong? Are they willing to sit with their client and go, okay, you're not ready, even though you have $60,000 worth of care that could benefit you. I'm going to let you walk on my door because you're not ready for this. And I know as a therapist that if you're not ready, it's not going to have a good outcome. End of story.
Yeah.
It doesn't matter. You could be the greatest biological dentist, the greatest flow practitioner. If that client's not a ready participant, willing participant to sit there, don't bother. You're working against yourself, because the placebo effect works both ways, right?
Yep.
The placebo will work if you want it to work, and if you don't want it to work, it won't either, because that's how powerful you are, and it all comes from within you. But I also want to mention that, like, she'll do tongue ties because she looks at the fact that the mouth and the fascia restrictions are going to have a lot to do with your TMJ issues, that she's not just going to inject plasmapheresis plasma-rich filament in your TMJ, which is another great thing she does. Like, she's looking at the body as its wisdom. And so if you could talk about the stem cells you use a little bit, and how you use that, and how you didn't use ozone and now you do, like, these are all great things for people to be aware of, that it's not just, oh, my dentist uses a biological dam and they read a cone beam and I have cavitational surgery and they just learned it last month.
Yeah. It's very humbling, when I look back, right? What you don't know. But then when you know better, and it makes you more humble. Like when I first started, I didn't know anything about the things that I know now, but with experience and working with other doctors and going to international meetings, medicine is sometimes more advanced in different pockets of different countries. So, for example, you're speaking about the laser dentistry. We have a laser that is phenomenal. It's non-invasive and it's so respectful of the tissues. I do all my surgeries with a laser. Patients say, I'm not swollen, I don't have pain. Is because we have a lot of resources, using plasma, for example, the plasma-rich growth factor. I learned that. I went to Spain to be trained 20 years ago, when that was not even being done here with Dr. Anitua. And I was fascinated because I went to a lecture where they were injecting plasma on a leg of a diabetic person that was going to be amputated. But they did not amputate. They don't amputate in Spain because they use plasma-rich growth factors instead of amputation. And my entire family in the past had been diabetic, and I lost family members due to that. So I immediately booked a flight and went to Spain and learned how to do plasma. And then I met other doctors that were not dentists. They're using it to prevent glaucoma. So they put the drops in the eye. So I use the plasma with patients that have TMJ, for example, people that have come, they fly to see me because I put the plasma on their joint and they have suffered for 10, 15 years, and that heals it. Well, that's a wonderful tool to have. Frenectomies, like you said, the tongue ties. For me, that's a basic thing when you do an examination, because also that can affect sleep and cause sleep apnea, for example. That's a big thing now, sleep apnea. Well, a lot of the patients have overgrowth of the jawbone on the bottom. They have no room for the tongue. The tongue gets displaced to the back, and then it's blocking their airway. I have patients that, in
a 45-second laser procedure.
Yeah.
That causes almost no blood. I mean, I did it on my 7-year-old. Oh, I didn't do it. I had a dentist do it, and literally changed everything because he had an upper and a lower, and his 2 teeth that had a big gap within 3 weeks, the gap went away.
Yeah.
And
save money in braces. There you go.
Exactly. And this is, as a fascia therapist.
Yeah.
I really recommend people look at your tongue ties, your frenectomy ties, because it can relieve so much pressure up in your head and your neck that you'll be astounded and will prevent you from having to do a lot of other work.
You can breathe better.
You can breathe better, your chin, neck, pain,
it's not holding the hemispheres of the left and the right. Just release it. It's amazing. So there's a lot of things, throughout the years that I have learned. When I started as a biological dentist, ozone was not a thing. But, maybe 15 years ago, or maybe more, 17 years ago, we got the ozone machine, and we do biopsies, DNA biopsies on the patients when we remove the root canals, and then we can test back, and we can do another biopsy later. It's almost like to see how things are. So there's a lot, there's a lot of layers, like you said. What I would recommend for your, clients that are watching, knowing the basics, if a biological dentist tells you to get a root canal, maybe they're not at that level of knowledge that that's not a good idea to have a dead organ in your jawbone, because that's going to have a lot of, bacteria that's going to go into the meridian of other organs. And if we see patients, actually, the cancers clear out after you actually remove the cancers, the root canals that have fusobacterium, in the breast meridian or the prostate meridian or the kidney meridian. We do an examination, and the patients are going to walk out with a meridian chart, yellow out all the teeth that are affected. These are the meridian charts. We send it to the doctors that refer the patients to us with a full report. These are our findings. The baseline in dentistry, any time that you have a patient, the first thing is if they have gums infected, that has to be addressed. You don't want the gums to be open and receiving bacteria and chemicals and whatever. That's a baseline. So nobody gets treated until the gums are healed, because that's not a good beginning. All those gums are open and all the bacteria going in. You have to get that. And then that automatically is going to protect their hearts. A lot of people walking with bacteremia, endocarditis, things that are so preventable just because they haven't gotten their gums disinfected. It's not such a basic thing, but believe it or not, after 26 years of doing this, every new patient, they're not aware. Nobody taught them. Nobody spent the time. They're like, you're the first dentist that spent an hour teaching me how to clean my mouth. Not only we're going to teach them, we're going to coach them. We're going to bring them back. And then let's see how you did. And we see how they did, and we coach them again. We watch them do it. We teach them do it. And it might take 3 visits or 4 visits. It doesn't matter. If they don't learn the basics after we, clean them up, they're going to get back into a unhealthy state.
Right. And that's where I come from. It's self-care or healthcare. And I love that you teach that and then you coach that, because what I say, and you might not know this because, we're just meeting, but I say if you brush your teeth twice a day, you should pump your lymph twice a day. And you got to start to learn how to have your own care of your mouth and your lymph system, because what you want to do, no offense, is stay out of the dental chair.
Yeah.
You're cleaning.
That's what I tell my patients.
Like, stay out in dentistry to be healthy.
I tell my patients, I want you to be independent of me. I want you to not have to come here at all, only for your cleanings, or if you have a hygienist that you trust where you're at, because many people come from different states, different countries. So I want them to own it, to be responsible of it, and to say, I am in charge of this. So, but they don't know. If they don't know, they don't know.
Yeah. And they don't know how it's, affected by food and all the things, which is fascinating to you. And I've been doing this for 2 decades, but yes, you are truly a breath of fresh air and have breathed some life into me back to biological dentistry, because honestly, and so many of my community knows that it becomes, the longer you do this, and it's why, again, I started this with the first interview as a biological dentist, because you cannot help somebody long-term with their health if you are not addressing the mouth, because it's connected. And for whatever reason, there's lots of reasons, but the ADA and the AMA split in the early 1900s and started to say, the mouth has nothing to do with the body.
Doesn't make sense.
It doesn't make any sense. As a vet student, that was the opposite. You looked in the mouth in order to see what the health of the animal is.
Right.
But then the human mammal, we went, nah, that's not how we do it. What? Okay, so we're here to throw some logic back into it. It's the divine's time to lead. It's the heart. It's the authenticity. It's the knowing part of us that really is here to show up now, and for us to take responsibility for our own healthcare and for teaching you how to empower yourself so you can take care of yourself, so you're not dependent upon somebody else or something else, because all the wellness is right in here. I'm going to say that a million times before maybe you hear it, but truly there's nothing outside of you need. You definitely need to handle the blockades to healing, which are dental foci, dental blockades, which if you don't know what those are, listen to episode 1, 5, 9, 12, 15, like every bout fit, because there's a lot of them.
Wow,
okay.
that's awesome.
There's a lot of dental blockages. And when you get to the other side of the equation and you understand regulation and all that, you know the most important thing you can do is eat proper food, chew properly, have proper alignment so that you can stay healthy, and then you've got good airways and all the things to stay healthy. And it all starts right here in the mouth. So you have just been truly a breath of fresh air, and I would love to give you another few minutes for last parting words, but I also want to say if you want more information after this episode, I think what we're going to do is not only give you this PDF for those that are part of the membership, but also maybe record a little bit extra deeper about stem cells, PRF, how that can help, because I think this is something that's missed, and also a little bit more about tongue tie and why that's so important for airway, because I know a lot of people are getting, they're getting all these airway appliances, as did I, and literally cutting my kids' lip tie was like, well, gee, that was a lot easier. Maybe you should do more of that. So anyway, what parting words do you have for the community?
Well, one of the things that I would like to share is that, don't be afraid. Fear is not going to give you the energy of fear is not as good as the energy of hope. And there's good people out there. We're all learning. I'm learning all the time. And, like Robert Bale, in the past, people used to do coconut oil and do switch for 10, 15 minutes. And now they say do it for 2 to 3 minutes, right? So there's always things that are moving along, and we learn from each other. But, I pray. I think that the connection of, God puts in you, in your, it's called intuition, the knowing. When you're in the presence of another human being, are they honoring you? Are they present? And then do you feel right? Just those things, because it's very complex, and I will give you the 10 things about, plastics and avoiding plastics and what are alternatives, things like that. But, we know when something is right, and the intention of the other person. And you don't have to make decisions right away. You can visit various different biological dentists, and interview them, and then choose somebody that resonates and do your homework. It's very important, because if somebody's going to send you for a root canal and they're biological, that's contradictory. And then there's people that know more, and there's people that are starting, right? And I don't put that down, because at one point I was starting as well.
Right. So we all have our value and know where your case is at and what you're comfortable with, and find that alignment.
Yeah. Thank you so much. It was a privilege, to speak to you, to know you, and you're doing a terrific job. And I pray that, you go viral. Now that we have your information, we'll share it with our patients, because they need to know more, and we try to share what we know, but, bringing a patient into a stability for them to have peace when they're with you is very important, because the adrenals producing cortisol is not going to have the person heal at all. You cannot heal when you're in fight or flight. So those are things that are so basic. But, it's not basic when people don't know it. So thank you so much for having
that never have truer words been said. I really appreciate you tying it up like that. It is so true. Thank you. Thank you for the work you're doing, and continue all the great effort. And I look forward to hearing about all the great stories of all the healings, just like you said. We'll tell a few of those on the second part of the episode. But for now, we thank you for joining us, and thank you for sticking with us here. And if you want more from Dr. Yolanda Cintron. Join us on the membership on part 2, and we look forward to that, and we look forward to her checklist. So thank you all. Talk to you soon. Oh, tell them where they can find you. I forgot to ask you that. What's your website and all that?
My website is gonaturaldentistry.com.
Perfect.
It's an encyclopedia of information. We want everybody to be educated. It should not
be link here in the show notes. And you don't do Instagram or anything like that, right?
We do. I have Go Natural Dentistry. Is my daughter is more knowledgeable about that, but yeah, gonaturaldentistry.com, dryoli.com. We put a lot of things. I have patients' testimonials because they can say it better. Patients can share better their stories, So we're on Instagram, we're on Facebook, and the website would be most probably gonaturaldentistry.com is great because they can actually research. We have an encyclopedia of information, so that way, they can get educated. But we're more than happy. We're in Fort Lauderdale. A lot of people fly to Fort Lauderdale. Has 3 international airports around us. So if they want to be seen, we have a patient concierge that she's fantastic, helping people.
Following you now.
Yeah. Thank you.
I'm following you now. That's great. And Fort Lauderdale is where you're located. And I'm looking at some of your posts. Wow. More people need to follow you because I can see your posts are very valuable and a lot of pictures which speak 1,000 words, and you're really educating. I appreciate that. And so does this community. So I'm sure I'm sure this is only the beginning of our relationship, Dr. Yolanda. So thank you.
God bless you. Thank you so much. Have a great day.
Well, champions of the vibe flow community, energy flowing through that body, thank you for sharing this time with us and getting through the entire episode today. I know time is what we're spending here as our currency on this planet as people, and it really does mean a lot that as we devote our time and energy into creating this content, that you stuck with us throughout it. So if you would like more on this particular subject from this expert and get that free gift, make sure to register for our Energy Flow Forum. And you too, with a very nominal price, can access all sorts of upgraded content and deeper dives into the very subjects that you love: energy, fascia, lymphatics, oxygen, and water. As you know, as always, on this show and any content that we create, it is for your own health purposes. This is not intended to be advice or medical diagnoses or professional advice. It's purely information that if it resonates with you and you apply it and you upgrade, we love to hear about it. What a great coincidence, and we're happy to be on that journey with you. If this doesn't resonate with you, and you know somebody it will, pass it along. And in the meantime, know that we truly are here to show you and explain to you and be with you through this lovely journey of life, and to share our experiences together and help each other upgrade, because that's how we're going to do this, together, collaborating with love at the center. I'm Kelly Kennedy, and I am so grateful from my heart to yours to share this time, energy, and space with you.